Good morning, everybody. This is Kevin Crone. I'm the Director of Nursing at Valley West Post Acute. And this is my COVID 19 update. Today is August 13th. We got some great news. We don't have any residents right now who have any symptoms of COVID 19. And we have had some residents and staff who have tested positive, but they are since now considered recovered because they've no longer having symptoms, and it's been so long ago. So now that we have 2 weeks in a row that we've had no one test positive for COVID-19, that means that we can now go to a less frequent testing schedule. We will now test 25% every week until we get 100%. So that's great. We're going to make up a list of our employees who were negative. We're not going to retest positive staff. Those staff that were negative will be put into a barrel, and we're going to divide them by 100% of those by 25% by 4, so that every week we will be testing 25% of our staff. You'll be notified which week is yours, but all staff who were previously negative not positive will be tested, and we have to do that once a month. So 100% of those who have been negative will be tested every month. We're going to make up a list, and we're going to assign you a week to do that. You can trade with somebody, meet with us if you're going to be out of town or on vacation or something, or something like that. But anyway, it's going to be on you to do. That's the bad news. You're going to now have to go to LHI or Ampla Health or Quest or however you want to do it, but you're going to have to do that testing on your own. We're no longer going to be doing it here in the facility. It's still free to you, and the results will be sent to you, not to us. But you did sign a waiver in June saying that we get a copy of your results of your test. And so when you're testing, you need to bring us a copy of that. And we need 100% compliance, or we'll be not following our mitigation plan for COVID-19, and we could be subject to disciplinary action from the state of California. I want to talk about our isolation area here a little bit. Red zone is where we're going to have isolation. We're going to be having those people who test positive for COVID-19 or are showing symptoms of COVID-19 placed in the red zone. The red zone moved. It's now room 101A, and it goes to room 103D. So that's actually 7 beds, but one of those rooms, 102, is going to be the break room. So the break room will be just for staff. It's got a bathroom in there. That's where they do their charting, take breaks. It's got a little sliding glass window in case you want to get a breath of fresh air. But the entry and exit for staff that work in the red zone will have to be through the front entrance in the lobby. Now, the good news is right now we don't have anybody in the red zone. There's nobody going to be staffing that area. Now, when you do work in that area, you will be wearing a fit-tested N95 mask, and you'll be wearing a full face shield, gowns and gloves, and we're going to continue that same practice that we've been doing. Yellow zone, this is our quarantine area. These are for people who may have been exposed to coronavirus. They may have been to an appointment somewhere. They may have gone to the emergency room, or they had an appointment, or they went to the dentist, something like that. And that means that they could potentially have been exposed to COVID-19. So these residents need to be separated from the rest of the population for 14 days. During those 14 days, they're going to be watched for symptoms to see if they develop COVID-19. If any one of them have symptoms, they go straight over to the red zone. So they must stay in their room with the door closed. Staff entering will wear N95 mask, a full face shield, gown, and gloves. Privacy curtains need to be pulled between residents just because they may have different exposure. One may have been exposed to, potentially exposed to COVID-19 at the ER, and the other one may have been exposed while going to the dentist, 2 different locations. Also, we're going to try to be putting people who, to care for those people who were tested positive for COVID-19. That's just a better way to do that if we can. Now, right now, we only have, 3 residents in the yellow zone. 4 residents. Tomorrow, we're going to have 3. Those 3 residents will have to be cared for by 1 nurse. I'm not going to assign a CNA and a nurse both to those 3 residents, just 1 nurse. Just so you know, it's going to be a little tough. It's kind of lopsided because now the Station 2 carts are have added residents to them, and Station 1 has dwindled quite a bit. Green zone. This is everybody else. Green zone is from room 109A all the way back to the unit. So this is an area for residents who have either tested negative and are not showing any symptoms of COVID-19, or tested positive for more than 10 days ago and are not showing symptoms. They're considered recovered from COVID-19. Also 20 days. If they have an immune deficiency or are immunosuppressed, they need 20 days before they can come out. But anyway, green zone is for people who are negative for COVID-19 or were positive but have since been considered recovered. Remember, red, yellow, and green areas are staffed separately. No crossover, please. Now, some of the things we're doing to stop COVID-19 here in our facility, I just want to remind you, we don't want any nebulizer treatments on our residents. So if somebody has one, and I think I've done a chart review and not found any, but if you see somebody who has aerosol breathing treatments, we need to talk to Dr. Garrison or Maksud about changing it over to something like an HFA inhaler. We can use a spacer, gadget, whatever, but we can't have nebulized medicines. Remember, early assessment of every resident. That means temperature, O2 sat, and a quick look at their respiratory status. That's 3 times a day. Every 8 hours, we need to do this diligently. And what I mean by early assessment, I mean that don't wait till the end of your shift to check temperatures for your shift. You may have a resident who is showing symptoms or maybe coming down with COVID-19, and you won't know it if you don't do it. So make sure that your CNAs, or you can do it yourself, are checking the temp and the pulse ox at the beginning of the shift. The other things that maybe indicate that they may be coming down with COVID-19 are a change in mood or behavior. We have some dementia residents who won't be able to say, oh, by the way, I lost my sense or taste or smell, you know. They may be eating differently now, or they may have headaches or body aches, so they're behaving differently. You have to think like that when you're looking at our residents. Remember, wash and sanitize your hands often. Foam in and foam out when you go into those rooms. Every time you touch the front of your face mask, you need to wash your hands or sanitize. When touching something like the telephone or the counter or even the stapler at the desk, I need you to sanitize. Every time you touch a resident and pick up their remote control and place it back on their overbed table, sanitize your hands. Sanitize your hands often. Janice and I will be checking, and we're going to just give you friendly reminders about your hand sanitizing. Remember, wear your personal protective equipment correctly. Don't crisscross the straps, not hanging off of your nose. By the way, we now get to go to surgical masks. We no longer have to wear N95 masks. So remember, take it off of your ear loops, fold it inside like that, and then fold it over and put it in its bag when you're taking it off. If you touch the front of your mask, what do you have to do? You have to sanitize your hands. Okay, so we can now go to regular surgical masks. We have enough that you can change them out every day, but there are some who we're actually saying, actually, if you want to change it every day, you may, but we have enough that we don't have to do a 3-day rotation on them anymore. Remember, social distance, 6 feet apart. Do that when you're standing and talking to somebody in the hallway. Do that when you're placing residents in their wheelchair and having them sit up in their wheelchair in their room. Don't set them right next to each other. Station 300, this is especially difficult to get them not to stand 6 feet apart. But we need to encourage that, and we need to continue to try because, as Dr. Garrison's YouTube video explained, we increase it makes it 4 to 5 times less likely that we're going to get a spread of disease if you maintain 6 feet apart and for 15 minutes or less. Avoid crowding at the nurse's station. Use an overbed table to do your charting out in the hallway if there's somebody sitting too close to you. Nobody should be sitting right next to each other at the nurse's station. One on each side of each desk is fine. 6 feet apart. Remember, 6 feet apart. Absolutely no food or drink at the nurse's station, on your med cart, hidden in a cabinet under the sink. You may only eat and drink while on a break. I just need to go on record as having said that. Janice will be looking. We actually saw somebody just the other day walking down the hallway eating potato chips from a bag out of her hand while she was walking down the hallway. Don't do it. You'll get in trouble. Use your car as a break room. That's still the only safe place to remove your mask and eat and drink. You can also go outside the patio, weather permitting, and have your lunch out there, but stay 6 feet apart. We'll no longer have people at the door taking your temperature. So when you come to work, that door is going to be unlocked in the back by the parking lot. You need to stop. Everybody needs to stop right there, take your temperature, and record your symptoms. If you have a temperature or if you answered yes to any of those symptom questions, you may not walk in the building. Don't come in the building to tell somebody. You have to go back outside, get you on your cell phone, and call in. I don't want you in the building if you've got a fever over 99 degrees, over 99.9, or if you've answered yes to any of those COVID symptom questions like loss of taste or smell, short of breath, those questions. I also want to go back a little bit. I wanted to say, when we're talking about the masks, about goggles. We found that the best way to also prevent spread of COVID is to wear goggles. So these kind of goggles protect your eye really good, and they're very stylish. Wear goggles when you're out there on the floor and providing patient care. Now, if you're somebody who is in the office and you don't make any patient contact, you don't have to wear goggles. If you are going to be providing care in the yellow zone quarantine area, I prefer you to wear a face shield. And of course, if you're in the red zone, you must wear a face shield. We can resume other things if we do it right. We can now have small group activities again, but they have to be 6 feet apart. So the Hollywood dining room is got 5 tables in there, so we can have 5 residents in there as long as those tables are not right next to each other. So we're going to start resuming bingo in there. We can now have family visit, but they have to be pre-screened. They have to be make an appointment to come in and visit their loved one. And to make an appointment, you have to be screened. Linda Hatfield Carlson is the person that's doing the screening. So let her know if you have a family member who would like to make an appointment to come in and visit their loved one. So that's an appointment only, and it's only one person and for 1 hour. Now we're going to start having other groups coming in too. We're going to start having hospice nurses can come back in. The dentist is going to start coming in. Other people can now start coming in. But they need to be screened just like anybody else. So when the wound doctor comes, I've called and I screen her for, does she live with anybody who's got COVID-19 positive? Is she having any symptoms? Does she wear a mask when she goes to Walmart? those kind of things. I want to thank everybody for watching my video. Please leave a comment in the section down below this video, because this is the only way I can track that people watch this video. It records your name, and the comment doesn't have to be good or bad. It could just be, you could just type not applicable or thank you or whatever you want to say. But if you leave me a comment, then I can track who attended this in-service. Thank you all very much for all the hard work that you do, and I'll talk to you again on the next video, probably in about 2 weeks.